TopMedTalk.
Well, hello and welcome. It's Anesthesiology 2021. TopMedTalk is here in person in sunny San Diego in the exhibit hall for the annual meeting of the American Society of Anesthesiologists. I'm Desiree Chappell, host today, and I'm joined by my co-host, editor-in-chief of TopMedTalk, professor of anesthesia and critical care at the University College London, Professor Monty Mythen. Hello, Monty.
Hello, Desiree. It's great to be here. Now, do you want the good news or the bad news?
Well, of course, the bad news first.
The bad news is, we're in the exhibition centre, which is fantastic. It's wonderful to be in here. But it's very sunny outside. I've actually walked outside. It's sunny and lovely out there. And we're on the bay in San Diego.
Yeah.
So it's kind of a mixed blessing, but we're here and delighted to be bringing free open access medical education to the world. So there we go.
There we go. Well, that's a great entree into Top Med Talk, Monty. There may be some new listeners here who are just joining us for the first time. So tell us a little bit more about Top Med Talk.
So started originally with perioperative medicine discussions. It's a global free open access medical education podcast provider. You know, we've done the majority of work together, Desiree, and we have done over 1,500 podcasts we've launched now. We've had over 1.5 million downloads, and we'll be listened to in over 100 countries around the world. So
that makes me tired just thinking about it.
No. I have to check it all.
I know, you do, me too. Well, if you are interested, we have all topics in perioperative medicine. I think we've covered just almost everything, Monty. You can find it at topmedtalk.com and other resources at ebpom.org, Monty. EBPOM is evidence-based perioperative medicine. It's our educational organization. TopMedTalk is the broadcasting arm of EBPOM. So just very quickly tell us a bit about that.
So EBPOM itself is 25 years old. It's another global organization. Starting around the time of that discussion about the journey from anesthesia in the operating room to the holistic care of patients, which I now think after 20 plus years has become mainstream. Now, around the time of, prior to COVID, we'd already made a decision that we were going to live stream everything audio free to the world. But then once COVID started, we were very early in with launching our educational hub. Yep. And we've run a number of virtual conferences, which are now going to hybrid, and more than 20,000 people have participated.
Yeah,
which is great.
It is great. It's fantastic. Well, Monty, one of our favorite things to do is connect our listeners with technology and those things in our space that we talk a lot about, but we don't, especially in this virtual world right now, get our hands on. And so we've had the opportunity here in the exhibit hall to actually meet with one of the exhibitors, and we have Amy Wilkinson with us today, who is with Butterfly Network. Amy, thank you so much for joining us.
Thank you. I'm thrilled to be here live and in 3D. I just can't even tell you.
In person. It's like you just want to tell you real. No, it's really cool. Well, Amy, a lot of our listeners and viewers come from the anesthesia space and are familiar with ultrasound. But for those who may not be, just tell us a little bit about the technology that we're going to be talking about today.
It's very, very interesting in the anesthesiology space. I find that the conversations have actually evolved around ultrasound in a really, really mature fashion over at least the last decade. So it's definitely been a specialty. I think that's really out in front of ultrasound, which is absolutely thrilling to be here and have that next level of conversation. Yeah. The interesting thing about ultrasound, as we know, is definitely really comes into its own at the point of care. And if there is a place where it makes sense, well, that's regional anesthesia, peri-op, and pain management. And so the ability to be able to have that technology accessible, to be able to support those three subspecialties, is something that we're really excited to talk about and to continue to understand and evolve, and continue to evolve in support of anesthesiology.
Yeah, that's awesome. Well, Amy, tell us a little bit. First of all, I didn't even ask you. Tell us about your background. I just jumped right into it because I'm super excited to have this conversation. By the way.
I'm exhausted already listening to the number of languages and whatnot. I only know one, unfortunately. Australian is it. So,
well, tell us about your experience with Butterfly and the company.
Yeah, it's been wonderful. So I've been with Butterfly for a number of years now. We productized and launched back in 2018. We're a small startup company. Recently went public in February, which was super exciting for us all. And our mission is to democratize the access to imaging. And so the best way to do that is to keep costs down and to literally physically make it accessible, both at the point of care as a device to help support detection, but also in terms of being accessible data for later on. So how do you grab the data that you need in order to make your clinical decision making or to support the procedure guidance that you're doing? But then what about after that? Where does that data go? How does that follow the patient along the patient's continuum of care? And that's sort of the hybrid model of the Butterfly network, is having this point of care ultrasound device, but also the network that's surrounding it. So we can not only help move the data around, but also help to make things easier as well.
Yeah, that's
if I may, Desiree, the ultrasound in our well-resourced world is ubiquitously available now. It seems as though it's everywhere, but we're familiar with, from that perspective, with the larger platform, if you see what I mean. You talked about the democratization, and I've heard about Butterfly, and I've got reasonably close to it, but looking at the image that I can see up on the screen here, it looks like you've taken a familiar ultrasound probe and plugged it into my smartphone. Is that what you've actually done?
Yes and no.
I know it's a bit more complicated than that.
But you're absolutely right. So what we've done is we've really leveraged people's comfort and accessibility to smart devices. So whether it be Android, whether it be iOS, people are really comfortable these days with these sorts of devices. So what better way to leverage usability than to apply it onto something that people are really comfortable with, swiping, pinching, these sorts of things, and often have them in their pocket as they're going around on rounds or they're in their clinic. So in terms of that aspect, that's definitely a critical piece of the puzzle. The piece that is very different and is needing to be understood is actually the technology that drives it. And I know that's very interesting for your listeners. And so I want to just spend a moment on that.
And I'll be delighted for you to do that in a second, Amy, but just to be clear, I'm being dumb here. It's not plugged into my smartphone, is that right? It can
be plugged in to your smartphone. We have over 40 compatible devices. So as long as it's one of the compatible devices, then absolutely you can.
I am moving
smartphone or tablet.
Right. Both.
Yeah. Oh, cool. So great stuff.
Exactly.
So I've got it now.
Right. So what you do, before we move into the technology then, let's take a step back. So what everyone can do is download the Butterfly IQ app right now. Yep. And you can do that from the Google Store or the App Store. What you won't be able to do is log in to said app in order to be able to get through our secure network, which is what keeps the data safe. So when we take images, for instance, they don't go to the photo reel, which is what we get asked a lot on your phone. They are securely encrypted and locked within the app.
Yeah. I know, and that's a piece that we get. I'm a clinician myself, and get that question a lot. It's like, where does all of this go? If it's on your phone, is that really truly secure? So, and we can talk about this in a minute, but like how we build the business case, to get devices like this in facilities that, really are very, very conscientious. I mean, most places are now, but just about this data safety and, kind of hacking and all that other stuff. So.
Absolutely. And I think it's such a critical piece of the puzzle. And that's why when I'm talking so wonderfully about Butterfly all the time and I get excited is because of that holistic nature of it. Yeah. It's not like just the device at the point of care. It really is focused on the security and the collaboration and the movement of the data afterwards and keeping that encrypted and safe and locked. And so our team has grown tremendously in the last few years. And I will say our medical informatics department in particular has grown exponentially because of these questions that people need to understand the answers to in order to be able to deploy at scale.
Yeah. Well, you're going to talk to us a little bit about the technology and stuff. So dive into that a little bit.
Yeah. So the first thing we usually get asked is, does it plug into my smart device? So yes, beautiful. That's beautifully on cue. The second question we usually get asked is there only one probe? Because usually when people are used to using ultrasound, they see at least 3 or 4 or 5. So the answer to that question is yes and no. So there is only one physical hardware device. There's only one probe. But what we've done is replaced the piezoelectric crystals, which is the fundamental piece of the puzzle that makes ultrasound. That's what every ultrasound device any of us have ever used has been with crystals. Those crystals are electrically stimulated. They resonate at a natural frequency, And that's what produces the sound. So if you have crystals that are making sound that's great for cardiac imaging, you collect all those crystals and you make a probe. If you have crystals that are excellent at doing perioperative procedure guidance or gastric volume, you grab all of those and you put them in a probe for that. What we've done is we've replaced crystals completely with a silicon chip. So instead of the typical 128 crystals that you have in a conventional ultrasound transducer, we have 9,000 elements which can be electrically stimulated through software to create ultrasound in a way that emulates the range of types of imaging in ultrasound. So for instance, when you go into the app and you tell the app that you're working on nerve imaging, the system will compute, and that's what the clinical team does, which is what I do. If I'm doing my job well, when you press nerve, everything that you need in terms of frequency, depth, dynamic range, all that stuff that's usually knobs on the system, we do all of that for you, so you're ready to do nerve imaging at high frequency linear. Gotcha. If then you wanted to do a cardiac exam, you'd go and tell the system, I'm now moving on to the heart. The system would change to emulate high frame rate phased array imaging, which is what you need for cardiac. So it's one probe, but it does phased array linear and curvilinear imaging.
Yeah, I've actually used the technology in practice. I got to trial it, and that was one of the things, just to be able to switch so quickly through. I did not actually understand how it works, so I'm glad I went through that. Yeah, that's
well, it's another question, right? Because people, and I will be candid and say, I had that question as an ultrasound veteran of 20 years. When Butterfly approached me, I was like, does it really work?
Come on. Yeah.
But that's the reason. It's this evolution of digitization and everything that's happening with digitization, with photography, with computers. It's bringing that same philosophy over into diagnostic ultrasound.
So, I mean, this sort of overlaps with a regulatory type of question. So, I mean, there's almost nowhere that people aren't putting ultrasound or trying to image with ultrasound now.
Yep.
Do you? And I don't know how far down the menu goes. If you see what I mean. If you want to look at, for example, trachea.
Yep.
Is there a thing that says trachea, or is it a part of the body?
Very good question. So that we do have an app for that. So
of course.
By the way, we do not script anything.
No, I know. Look at us jamming, freestyling. What you need to do is tell the system within a ballpark of what you're scanning. Yeah. So for trachea, for instance, you might choose soft tissue or you might choose small organ. Okay. From there, it knows to do high frequency linear with great contrast resolution. All you need to do as the user is to swipe up and down and tell the system where the trachea is within the image.
Gotcha.
Because everything else, as I said, is linked not only to the preset but also to the depth.
And before we sat down, we had a little pre-chat and we started to talk about muscle. Which been involved a little bit of muscle imaging research in the past related to how people respond to exercise regimens, for example. And I think you were suggesting the fact that the muscle imaging is part of that. Is that both is it quantitative and qualitative at this stage?
That's a really great question. So ultrasound generally is a qualitative tool, as we know. We do have quantification tools on board. So we do things outside of the United States. We do an auto-ejection fraction measurement. We do pulse wave Doppler, so we can quantify blood flow. And so it's, again, trying to make ultrasound more objective, trying to make ultrasound more quantitative and actually be binary. This is your number, yes or no, and go. And so it's definitely, we have quantification tools on board, and we are moving forward through an automation process to even go beyond quantification and right over into data collection on its own in the future.
So we need more time for more conversation.
We do. I know. We're looking at I was looking at the time.
Quadratus lumborum.
I know. Well, come to the booth.
I know.
Come to the
we're
booth.
definitely going to get our hands on it. We can scan.
Yeah. Exciting.
Well, Amy, in our last little bit here, just tell us about some of the things that you are presenting here at the booth and have that we as anesthesia clinicians would be most interested in.
I appreciate that question. I think we're really looking at answering the questions that people have. And so what we're hearing on the booth already since 6:30 this morning Pacific, yay, has been definitely very specific questions around the subspecialty. So we have our peri-op friends come and they say, I need something on my body accessible for everything from gastric volume to a fast exam to a typical peripheral IV line to cardiac. And so we go through the nature of these 21 or so different presets, the types of things that you can do at breath with. So really, that's the number one thing, helping people to understand the technology and why we can do so much with one probe. Of course, the regional anaesthesia space have been such great adopters of point-of-care ultrasound. So, of course, we have some cool stuff to do with nerve blocks. We're actually highlighting a thing called Biplane Imaging, which leverages the power of the chip, where you can see images in both long axis and short axis at the same time. So that's something for regional anaesthesia. So come and see us on booth 2729. And then, of course, for our pain management. So looking at, how do we get really nice images from the 1 centimetre trigger points all the way down to hip and epidurals, and to talk people through how you can do that all in one preset.
Nice, that's awesome.
So we, in the trade exhibition 2729, where people might be able to see the TopMedTalk booth. Where are you in relationship to that?
Come from the front doors, come straight to the TopMedTalk booth, which you can see, and then turn left and go about 50 metres. What's that in feet?
Perfect. 2729. And if we need to look up on we've been told websites are old-fashioned, but I still use them. Do you have
a lot of us still do.
It's not tricky at all. Butterflynetwork.com.
Brilliant.
Yeah,
brilliant.
And you're on social and all that good stuff.
We are all over social. Please come to the booth. We've got all our hashtags and things, and we actually have a show special running through social as well. So please come and see us.
Check that out, because I want one of those bad boys. All right, I shouldn't probably say that on air, but they're that cool.
Appreciate your support.
Well, Amy, thanks so much for joining us. It was a true pleasure. Hopefully we can do this again.
Great.
And thanks for listening to TopMedTalk. If you want more information, please join us at the live.edpom.org site. You can find this conversation and others that we've had during the meeting. You can find more at topmedtalk.com. Just type in ultrasound. You'll have all kinds of good stuff there. And
thank you, ASA.
Thank you to the ASA.
Wonderful.
Cheers.
Thanks.
TopMedTalk.
Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EdPom, evidence-based perioperative medicine. We'd love you to find out more about that. If you check out edpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out edpom.org now.